Welcome everyone to today's webinar, CVR Showcase, a tour of our offerings. My name is Susan Howley and I'm the Project Director for the Center for Victim Research. The center is built through a partnership between the researchers and practitioners at the Justice Research and Statistics Association, the National Center for Victims of Crime, and the Urban Institute. The center's mission is to serve as a one-stop resource for victim service providers and researchers to connect and share knowledge to increase access to victim research and data and the utility of research and data collection to crime victim services nationwide. Today's webinar is designed to give you a tour of those resources so you can work with us to build an evidence base for victims of crime. Center for Victim Research and this webinar are both supported by funding from the Office for Victims of Crime, which is part of the Office of Justice Programs at the U.S. Department of Justice. And now I am delighted to welcome today's presenters, 3 team members of the Center for Victim Research. First, you'll hear from Laura Puls, who's the research librarian of the CVR. She's based at the National Center for Victims of Crime. Then you'll hear from Bailey Maryfield. She's a research analyst here at the Justice Research and Statistics Association and part of the CVR team. And we'll close with Marina Duane, who's a researcher and leads the TA efforts at the Urban Institute for the Center for Victim Research.
Hi, thank you, Susan. I'm so excited to talk with everybody. We're here to reintroduce you to victimresearch.org. The majority of the attendees said that they have visited our website, which is really exciting. And as Susan already mentioned, we really hope to surface parts of the website you maybe haven't seen before or give you some more ideas for using our resources. Again, these are all free, so please do share them and make use of them. Also, just continue to ask questions. Let us know what you'd like to see, if we're going too fast, parts that you found useful. We really want to make sure that this website is responsive to your needs and your workplace's needs. So with that, I was going to start the first poll, which should be brought up. We'd like to know which sections of the Center for Victim Research website you've already visited. Okay, great. So it looks like the library has received the most so far, so that's exciting. I'm going to do just a little in-depth tour of the library for you now. So this page should look familiar. This is the home page for the library. At the very top there is the search box, which will be your entry to the evidence base. Some of the benefits that we're hoping that you can take advantage of from the library is that you can have one place to search for research literature that's showing us what's the evidence base in victim services. There have been other projects that are trying to build the evidence base, and a lot of the time they're focused on a specific victim population or specific type of victimization. And we want to not duplicate those efforts, but really amplify them and make sure that people are finding what they're looking for. So you can search those websites here from the library search box using your own words. It doesn't cost anything, and we also provide tailored search help and referrals to our partner libraries when they have something that we know they've already worked really hard on. They've created a lot of bibliographies and items like that. So we would just want to make sure that the existing research is easier to find. And with that, I also have my first library poll. I just wanted to know from the attendees, do any of you work on Victims of Crime Act funded programs? Great, so it looks like most attendees have some kind of Victims of Crime Act funding. I ask because the library has 2 parts. There's the public search box that anybody can search. You don't have to log in. And there's a full collection, which includes all of the open access free materials that are in the public collection, as well as our subscription journals. So if you receive Victims of Crime Act funding, you can register on our website. And if you click on Login and then Register, there's a box on the end there for VOCA funded agency users. And if you have your VOCA grant number ready, you can just fill out a few questions and be on your way to getting access to the full collection. Today I'll be demonstrating the open access library, which everybody has access to. And I do want to emphasize that if you have any questions about how we've come up with our user group, or if you have an article you're trying to find and you're not coming across it, please let me know, please get in touch. So a little bit about what's actually inside the CVR library. Like I mentioned before, we have a lot of partner libraries who cover different topics. Our library covers all of those topics for every type of crime victim, every type of victimization, and every type of service. We are also unique in that we not only include some of the academic typical research formats like journal articles, but we also have a variety of white papers and fact sheets, research briefs, videos, slideshows, everything that has some kind of research base, we want to have it included. And we recognize that not everybody has time to read a 20-page journal article, so it can be really helpful to have all of that research distilled into easier to read formats as well. And those results can be based on surveys or needs assessment. We also have a few investigative reports, since there can be some really important journalism covering topics that are maybe not always talked about or difficult to study in other ways. So we're moving on to yet another poll. So thank you everybody for participating. Okay, so I did see there was a question in the chat, and I'll get back to that once we just fill out this poll as well. For people who had already registered, I was curious about how you've been using the library and if you've used it for any of the following uses. If you don't see something you've used it there, please fill in the chat box to let us know what you've used the library for or what you wish you could use it for. Okay, thanks for participating in that poll as well. And while I'm waiting for the results to come in, I see that there's a chat asking, how are the fact sheets and briefs linked to the journal articles? It's a great question. So we try and include fact sheets that usually summarize multiple journal articles a lot of the time. They're just summarizing what a lot of different research literature papers have said just in one place. Usually the fact sheets and research briefs are just going to be a lot shorter and in more everyday language than journal articles. So it's not always one-to-one. There's not always one fact sheet per journal article. They're a mixture of both. I hope that makes sense. Great. It sounds like most people have used the library to add to their training materials and for their own professional development. That's great to hear. I also hope that as grant application season comes around and more funding proposals require you to show that your program follows the evidence base, that you consider using the CVR library for finding additional journal articles that discuss how your program matches the evidence base. Thank you. Susan mentioned in the chat, and I mentioned earlier too, that another benefit of the Center for Victim Research Library is that we really are here to help you at any point in your library search process. So you may already have an article journal in mind. Maybe you've run into a paywall and you can't get the full text. You read just a summary of the article and you want to read the whole thing. Please shoot me an email and I'll see what I can do to get a hold of it, or at least try and find you a similar article if it's something that we don't have in our subscriptions. On this slide, I have my direct email address as well as our contact form link. And I'm just going to go over a couple ways that people have reached out to us, some types of questions that they've had, and just so you have some ideas. If your question is relevant, I'm sure that it is, or I can direct you to the right person. So in the first example, sometimes we hear when we're at trainings that, or during a meeting, like everybody knows, and then there's some kind of statistic. I always try and remind myself to question, like, how do we know this is true? What is this based on? Is there additional information that we might be missing, or some other context that's not included in things that everybody knows? So for an example, some questions I've received before, just trying to figure out what's the background on this information, what's the proof. So during a training, the questioner had heard somebody say that we know that interventions within 72 hours reduces the likelihood that a survivor would need services in the long term. And so I searched through the literature to try and find where did this 72 hours come from. And as far as I could tell, a lot of emergency responders have this in a lot of their policy guidance, that the 72 hours is really that requirement for responding to victims. I would be interested to know if other people have come across the same kind of requirement in their training. Another question I received related to just common statistics that we hear about a lot, but maybe don't always know where they come from. I had a requester ask why she sees both the numbers, there's 1 in 3 or 1 in 4 women experience intimate partner violence. And she wanted to know why there were 2 different numbers. I was able to find that the CDC Intimate Partner Violence Report lists both numbers, and the reason why there are 2 different numbers are because it just includes different types of behaviors that count as intimate partner violence. So depending on your definition, it's 1 in 3 or 1 in 4 women who experience intimate partner violence. That's an example of how I can work with you to dig into what the research literature says, where some of these numbers come from. Second, and this sounds like it might be familiar to a lot of attendees. You might also be training somebody, and these people that you're training may not have as much of a background on victim-centered practices. So sometimes people believe a little bit more if we have specific facts or statistics or quote-unquote objective findings that can also complement the things that we know to be true, things that are based on our own personal experience in the field. So just keeping in mind like some other research findings that might help us convey our message to people who are really looking for some of those hard findings. So for example, I worked with somebody who wanted to have some information and statistics about the prevalence of sexual assault for males. And she found this particularly useful for presenting with high school students, where there can be such a stigma as well with reporting or maybe not seeing what has happened to you as sexual assault. So just being able to have those statistics were really useful for her in her presentation, just being able to demonstrate that the male students weren't alone. Relatedly, another requester had asked about finding some average timeframes for the therapeutic process. Again, not everybody has a victim-centered view or understanding of why we can't measure healing times, but still just having some kind of evidence base for average timeframes for people's recoveries was useful, just for convincing legislators why a 1-year funding cycle is just not sufficient for their programmatic needs. And my final example relates to when you're starting to launch a new program, or you just want to know if your current programs could learn from other organizations that might do things similarly. For example, we had a requester ask about how quality forensic work could relate to victim satisfaction with the criminal justice system. If they felt that the evidence was collected well, if they felt they were being treated fairly and asked questions that mattered to them, were they more likely to be satisfied with the criminal justice system? So digging into the literature to see if other programs had evaluated their forensic science labs. And I did find a lot of materials, especially in Great Britain, where there was a lot of discussion and need to prove that their laboratories were doing sufficient work. And I listed a couple other examples there, but I do want to get on to our demo. So we have a final poll just to make sure that people can have a little choice on what we're going to look at today. So we covered a lot of topics, as I mentioned. So if there's anything in particular from these 3 choices that you'd like to see demonstrated, I'd love to share it. So please just take a couple seconds and vote there. Okay, the poll is closed, so we'll see results in a couple minutes. If there are questions so far, again, please feel free to use the chat box, and then we'll get launched into our live demo of the library. Great, so looks like most people are interested in research about trauma-informed practice. Great, I'm going to, let's see. All right, I am trying to launch my web browser, but it looks like I don't have the right, okay. Okay, so I hope everybody's able to see the library website there. This is again the search box. Right now we're searching the public collection that anybody can search. And I'm going to start by searching trauma-informed. Like I said before, you can always just search in your own words and see which results you get. Okay, so we have 32 results here. And this is just a preview of all of
Lost Laura's audio there for a second. So Laura, I've taken over as presenter. If you're able to regain your audio, just let me know and then we can go back to your demo. So I'm going to go ahead and go into a couple other sections of our website. As we heard, the library is clearly a great resource for you, and as is Laura, who can help you navigate the library. So we have even more resources available to you as well. So the next section I'm going to go over is called Get Connected. So this section of the website, I saw that a handful of you have already visited. This is a section that offers several ways for you to build relationships with and get ideas from victim service providers and researchers. So under Get Connected, there's a Find a Partner page. So under this page, we have several different resources available to you. So we have service provider databases from several entities, including one from the Office for Victims of Crime. It's a really handy map that lets you go to different states and see the various service providers in those states. So these are national directories that have information such as location, service type, agency type, and victimization type served at that particular agency. You'll also find on this page additional ways to stay connected with the field of victim services through a listing of victim service conferences. And we attend many of those conferences, so always look for us there. The final thing that you'll find under Find a Partner is our researcher directory. So this directory is a first of its kind directory of victim researcher evaluators and evaluators. So I'd like to take a closer look at our directory. Here's a couple examples. These are two of our team members, Marina and Dr. Christine Murray. These are examples of the type of information that you will see under a victim researcher profile. So each person contains detailed information regarding their background and experience. And I do want to stress that this directory is free to join and it's free to use. It's live and available on the website now. So we currently have over 130 individuals in our directory from all over the country, various backgrounds and levels of experience and areas of expertise. We also ask for researchers to update their profile on an annual basis, so we make sure that we provide you with the most up-to-date information. So if we have researchers joining us today and you're interested in joining our directory, you can go to our website, victimresearch.org, and you can register for the website as a researcher. So you'll go to sign in and then register and select the researcher option to join the directory, and that also signs you up for our newsletter. So most individuals who join the directory will have experience in victim-related research. However, if you are a researcher or evaluator with an interest in the area of victim research, just make that clear in your bio you are certainly still eligible to be included in our directory, and we would welcome you. I also want to point out on this slide that you can register as a general user. So if you don't receive BOCA funding, or if you're not a researcher, or if you're a researcher who's unsure about joining the directory, please join as a general user and you will receive our newsletter updates. So one of the great features of the researcher directory is the easy-to-use search tool. I know this may be a little bit difficult for you guys to see on your screens, but I wanted to show you the many different ways that you can filter searches with the researcher directory search tool. You can search by state, type of victimization, type of special population, and/or research expertise. For example, if you were looking for a researcher with experience in research involving victims of sexual violence and in conducting needs assessments, you could first filter your search by those two requirements. And then the researchers who will populate the search will be individuals with expertise in both of those areas. Once you find a researcher or evaluator that fits your needs, you can connect with them via email right through our website. The directory can be used not only to connect researchers with practitioners, but you could also use it to connect researchers to researchers. If you're a researcher looking to get into a new area of study, you could use the directory to search for a researcher with specialty in that area and connect with them. Another part of the Get Connected section are our webinars and podcasts. So we actually store our webinars on our YouTube channel. So if you go to our website, victimresearch.org, in the footer of every page there is a link to our YouTube channel. Also, if you go to YouTube and type in Center for Victim Research, you'll be able to find us that way as well. So we have monthly webinars on a variety of victimization topics, including homicide co-victimization and elder abuse. We aim to have at least one practitioner and one researcher represented on each webinar. In addition to featuring victimization research, we also have webinars on topics such as how to build partnerships with researchers and practitioners, and how to have a successful career as a victim researcher in an academic setting. Additional resources such as quick guides are always shared after the webinar is concluded. So if you register for a webinar, you will get an email from us after the webinar takes place with a link to the recording and additional resources for you. So even if you know that you cannot attend the webinar, go ahead and register. That way you know you'll get the link to the recording afterward. So another part is our podcast, which we are very excited to now have on our website. Our podcast is called Tell Us About It. Our first two episodes feature practitioners and a researcher working with the Rocky Mountain Victim Law Center. These two episodes, episode 1 and 2, are actually linked together. It gives you a whole 360-degree view of the whole project and the integration of research into the Rocky Mountain Victim Law Center. These are short, around 20 minutes, so they're perfect to listen to on a break at work or during your commute, or when you're working out. They can be listened directly through our website or on SoundCloud. So please make sure that you subscribe to our SoundCloud station to ensure that you don't miss an episode. So now I'm going to talk a little bit about the featured research page. So one of the pages we have here is called Spotlight. These are quarterly releases of recent research. We collect information in various forms, such as webinars and reports, coinciding with commemorative days, weeks, or months, such as World Elder Abuse Awareness Day and the National Native American Heritage Month, as you'll see from the two examples I've put up here for you. So these are just two examples of resources that we've included in the Spotlight. Historical releases are maintained on the website, so you can look back and see what was released in previous quarters. So right now we have 3 Spotlight releases on our website, and the winter Spotlight will be released soon. So if you haven't had a chance to check out the Spotlight part of our page, you'll be able to look through 3 different releases. So there's a lot of great, interesting information on here. We really packed a lot of information into the Spotlight. You could literally spend hours on there. So another part of our featured research are our funded partnerships. So CVR has been fortunate to be able to fund 2 different types of partnerships. These are collaborations in the field between researchers and practitioners in the field of victim services. So the first type of partnership I'm going to talk about are the VOCA-SAC partnerships. So these are Victims of Crime Act administrators, compensation and/or assistance, and the state statistical analysis centers. For those of you less familiar with Justice Research and Statistics Association, or JRSA, we are the professional organization for the state statistical analysis centers. So this funding was distributed for those state-level crime and victimization researchers to partner with the VOCA administrators. So these partnerships were provided with $15,000 for 12-month projects. One of the items emphasized was the desire to create long-lasting relationships between the SAC and VOCA administrators. And as you'll see on here on the slide, that the final reports are going to be available on the CVR website at the end of this year. These projects are wrapping up at the end of this month, and we will be receiving final reports soon. So to give you an idea of what these partnerships are doing, this map here shows the 8 states that are participating in a VOCA-SAC partnership. So for example, Minnesota is conducting a survey of juvenile correctional facilities to better understand the prevalence of victimization among that population and their needs, and also exploring the services that are available to them within the correctional facility. We're also happy to say that CVR is able to fund 4 more state-level partnerships in the coming year. So this page will be updated with profiles of those 4 new partnerships. And you'll also see that the 8 existing have videos introducing the projects. We also recently had an in-person meeting that we recorded giving more of an update on the projects. So we hope to be able to edit those videos and post them on the website as well. The next type of partnership are the researcher-practitioner partnerships. So these are collaborations between local-level victim service providers and researchers, typically located in an academic institution. We also have a couple who work as private consultants. So these partnerships received $15,000 for 9-month projects. Various stages of partnerships were funded, so some of these researchers and practitioners had a long-standing relationship of doing work together, and some were new partnerships that CVR was able to provide some funding to get them going in their research together. So one of the things emphasized in these partnerships was the cross-learning. So we know that researchers have a lot to learn from practitioners, and practitioners have a lot to learn from researchers. So we wanted to emphasize that in these partnerships so that coming away from the projects, they have new knowledge and new appreciation for each side of the field. So the final reports of these these projects will also be available on the website towards the end of the year. So we had 9 of these local level fellowships. This map shows the states where they're taking place. I do want to make sure I let you know that these are not state level projects like the VOCA-SAC projects were, but we just wanted to show you with the map the location of where they're taking place. So For example, Illinois is working on a project to enhance the quality of advocacy for domestic violence survivors and their children, increase the capacity to engage in ongoing evaluation of their service delivery efforts, and generate research knowledge about the conditions in which effective survivor-centered advocacy services are implemented in a domestic violence program setting. So, as you can tell, these projects, they're really doing a lot with 9 months and $15,000. It's been very impressive to watch them form. So CVR was also very fortunate to receive approval from OVC to fund 6 more of these partnerships. So those will be launching soon, and same with the VOCA-SAC partnerships. Their information will be available on the website shortly. So I'm now going to hand it over to Marina, who is going to tell you about some other features of the CVR.
Thank you so much, Bailey, and greetings everyone from the East Coast. I saw early on that folks are joining from all over the country, from Austin and from California. I always love seeing how we are gathering the whole country together during our webinars at CVR. So, Bailey has nicely walked you through a couple of features that we have on the research tab on our website. And I am going to talk to you about research syntheses, which is actually our own research that we are doing in an interesting and somewhat unique way. And then just as a heads up, I want to make sure that you are prepared for what's coming at the end, and I will wrap up our conversation and a tour of CVR with talking to you about actual free support through technical assistance that we have available. So, to tell you a little bit about our own research that we are producing, basically, for the research syntheses, we are trying to basically do what it says, synthesize the knowledge on a variety of victimization topics. We have topics that we already mentioned before: co-victims of homicide, elder abuse, mass violence, and terrorism. Usually we try to prioritize the topics that we think are either under-researched or this is a very underserved population. All of the products that we develop eventually become available through our website in a variety of ways. To tell you a little bit about a method that we use to create this syntheses, we have adopted a theoretical model developed by the Center for Control and Disease, which really expands our understanding of how we should think about evidence. Some of us who are researchers or practitioners in the field tend to think about evidence and automatically think about experiential research, which is a blue bubble that you see on your screen right now. But a CDC model tells us that actually evidence lives in the middle of this Venn diagram and incorporates how programs are actually incorporated in the field, how practitioners actually implement them, and what kind of legislation environment they exist in. And also, it's important to know the context in which they are implemented and how victims or survivors themselves are experiencing it. So this is a theoretical model that we actually operationalized, so to say. Basically, at the Center for Victim Research, we developed a method where we are collecting both research articles that are more traditional, but also what we call practice sources, such as fact sheets, notable reports by experienced folks in the field. And we are analyzing both of those types of sources in a systematic way where we are asking a same set of questions, identifying strengths and weaknesses. And as a result, we code all of that. Then we start developing actually our syntheses. We start by creating an outline. And because we have multiple teams that are working on these syntheses, we have internal spot checks and quality assurance methods that we apply to make sure that we are really thinking through and applying the same kind of logic as we are analyzing those sources. But importantly, I also wanted to mention is that we work with external reviewers who look at our initial outline, and I should say that reviewers are represent both the practitioners and researchers, which is true to the mission of CVR, of bridging the gap between research and practice. And they tell us, here's what you missed, here is what you should be covering, and then we go on and produce different documents and actually products where we are really trying to disseminate knowledge. So next, I wanted to show you how we are actually sharing such knowledge. I'm going to share my screen, so bear with me, and I'm going to take you to our website. Hopefully by now you should be getting familiar with the website. I also saw that some of you actually already started using it. So if you go to the Research tab where I am right now and click on Research Syntheses, you will see that there's some information about the model that I just explained to you, but also we've already started featuring products on our first topic, which is homicide co-victimization. We published our own research brief, which is available for print or just on our website. And we also have a webinar where we actually, my colleagues and I presented on our findings, but also we, as Bailey mentioned earlier, we invited a practitioner who offered a lot of his useful insights on how loved ones experience a death of their loved one. So I said that we are working on multiple topics. Please stay tuned. We will also be publishing on our website future products such as long reports and on multiple topics. So we're going to go back to our slides. And now I wanted to move on to talk about technical assistance. And before I do that, we are going to do a true check, like Susan said, who is multitasking and most importantly, who is still with us. So we are going to do another poll. A poll should come up on your right hand side very soon. And the question that I would like you to answer is, what tools or support would be most helpful to you if you were to start on a research or evaluation project? I'm going to read through some answer choices while you select them. So the answer choices are defining measurable benchmarks, understanding program evaluation basics, exploring how to conduct needs assessments, explaining victim protections and ethical concerns, analyzing qualitative or quantitative data, individual support, or other. If it's other, please use your chat box and let us know what other needs you have. I won't be able to go through all of them today, but we usually do take the time to read through your comments, and then we will feature answers either through our website or through direct response to attendees. So let's take a moment I'm going to take a couple of minutes for you to answer the question. If you were to start on an evaluation project, where would you need help the most? Okay, we have the answers. Oh, we have quite a few people still with us, and it looks like a lot of folks well, actually, people need help with a lot of information. Looks like the winner here is analyzing qualitative or quantitative information. I see that folks are also interested in defining measurable benchmarks and understanding program evaluation basics. So this was somewhat of a trick question because what we've developed, I think, on our website will have some of the answers, but I also do see that some of you actually need individual support. So let's go back to our website. Actually, I'm going to share my screen with you one more time. And if you click on tools, some of you were said that you are interested in program evaluation and research basics. If you click on those tabs, you will see that we already have a lot of resources available to answer those questions. I wanted to show you one of them, or actually a couple, but we will start with victim protection. A lot of practitioners, when we talk to them in the field, as Bailey said, when we go to conferences, some people are apprehensive about what researchers need to follow or what they will be doing as they work with vulnerable populations such as victims. So we've developed a guide of our own that talks to you about protecting victims in research and sharing some resources by notable governmental organizations. We also have, just so that you're familiar with our resources, if you click on tools and tips, we've included a lot of links for you to look at other notable organizations who provide trainings and tips on how to protect victims when you're conducting research. And then another tool that I wanted to actually feature is showing our video on how to conduct community assessment. A lot of people in the field, when we talk to them, start thinking about conducting their own needs assessment, and we created a video that will feature how to conduct one. So Jason, I'm going to turn it over to you, and we will play the video now.
Isn't it frustrating when you have a vision for transforming victim services in your community, but don't know where to start? Trying to keep victims' needs at the forefront, maintaining relationships with service partners, tracking your program's progress, and racing to meet deadlines can get overwhelming. When you're trying to balance it all, it's important to get organized. A community needs assessment can help. Needs assessment is a research-based way to identify which victim services are working well and which require expansion or improvement. Two indicators of a successful needs assessment are that it, 1, provides a clear summary of victim needs in your community, and 2, identifies service deficiencies in meeting those needs. To make a needs assessment helpful to your community, you need to know when to use it. If you are looking for an evidence-based way to guide improvements in responses to crime victims, then a needs assessment can help. The first thing you'll need to do is define the scope of your assessment. What service needs do you want to address? Keep in mind that needs can and often do intersect with one another. From there, you'll want to determine the location. This can be a broad geographic region, like an entire state, or a small local community. After determining the location, you will want to understand the population's demographics, victim service providers in the area, and who the community leaders and stakeholders are. Now that we have named the 3 preliminary steps, let's build a community needs assessment with access. Step 1. Act together. Chances are, other organizations in your community want to see victim services expand and improve as well. By working with community partners and research partners, you can increase access to information and supportive resources. You will also form relationships that can help implement the actions identified as a result of the needs assessment. Step 2. Collect community data. Begin by searching online and talking to local organizations to figure out what's already available. Supplement existing research with new data collection. Surveys, interviews, observations, focus groups, and case studies are a few tools you can use to collect information from service providers, victims, or other community members. Step 3. Evaluate your data. Determine what key findings the information points to about victim service needs and where to improve or expand outreach and programming. Be specific. Identify the important gaps and challenges in overcoming these problems while also recognizing all the opportunities for growth. Step 4. Set priorities. Based on these key findings, talk with your community partners to collectively agree on priorities to guide future action. Step 5. Share your findings with service providers and stakeholders in your community, as well as other individuals in the field. After watching this video, we hope you know more about how needs assessments can be helpful to improving victim services in your community. If you would like further help, visit victimresearch.org. We have a searchable directory of victim researchers to partner with locally, and our own researchers provide free technical assistance to victim service providers nationwide. Thank you for watching.
Okay, So hopefully that was a good illustration on how we are trying to sort of reach the breadth and cater to a typical set of questions we usually get to produce a lot of these tools and training that we think answer questions just broadly in the field. But we also understand that context really matters, and sometimes people actually have specific questions that might not be either addressed through our website or that are just easier to answer when you're working with the researcher directly. So for that reason, we also have free of charge technical assistance that is oriented towards helping you with research. So I know we have a couple of researchers joining us today, but I also saw that over 70% of folks were practitioners or policymakers, so this would probably be of interest specifically to you. Basically, if you have a question about benchmarks, or you're just in the beginning thinking about how to conduct evaluation of your program and there are some nuances, we are here to help. I do want to say we provide light touch TA, so it's not like we are substituting your primary researcher purposes where we will start collecting primary data and start holding focusing groups, but we will guide you because we have a variety of my colleagues, researchers who specialize in different victimization topics. They also have very different technical skills in terms of methodologies that they apply in research. Some are qualitative, some are quantitative. Other researchers specialize in basic research. So we have folks who can work with you on a variety of needs. It's very easy to reach out to us. The email is included here on the slide. It's ta@victimresearch.org. You can also connect with us directly through the website by clicking on contact and just then selecting an option research-related question. We communicate with you over email or phone. I actually here at the Center for Victim Research coordinate technical assistance. I take a bit of time to really understand the scope. If you are in doubt whether something is in scope or not, just email us and I will respond and I'll let you know. But we definitely want to hear from you. And just like Laura did in the beginning, I wanted to show you a couple of examples of what we've already provided, what kind of support we've already provided. Please know that this is not an exhaustive list at all in the last year. I just tried to select a couple of examples that represent a variety of requests. So one request came from Washington State over here on the left of the map. And this one was relatively quick in terms of just the requester asked us to help think through the survey that they were designing to their members. This is a member-based organization, and our researchers worked on helping designing the survey and then thinking through how to deploy it to ensure that there was a good response rate. Then from the East Coast, over at the top, another request that came in was actually unique in terms of the subject. It came from the Coast Guard, and the requester was interested in evidence-based practices for victims of sexual assault who are suffering or who suffered while on duty. It was very practical because the requester wanted to think through next steps for the Coast Guard, and we were able to engage and work on best available research in that context. And finally, a third example is something that I think illustrates that it can also be a little bit broader in scope. So we worked with a national organization on thinking through multi-site demonstration project, and we were helping on process evaluation plan and questions. And basically, it was actually quite a lot of involvement, but our researchers were able to help all the local researchers on the ground in Wyoming and Michigan and Tennessee to make sure that they are all on the same page, and the questions that were being asked were comparing basically apples to apples and not apples to oranges. So again, some of our requests are very specific, some of them are a little bit broader in scope. We will work with you to really figure out the scope, how to hone down what would be most useful, and taking from there. So please reach out to us at TA@victimresearch.org. I believe this concludes the official portion of our presentation, and we are almost at time. You should be familiar with our website by now, but we are also available on social media, so please connect with us either through Twitter or YouTube or Facebook or LinkedIn. And I'm going to turn it over to Susan or maybe Laura to finish us, and I'll show the library if we should. So Susan, back to you.
Thank you, Marina. I'm going to ask Bailey and Laura to work together to just give a couple more minutes and let people see what they missed with the library. Bailey?
Hi, this is Laura. Thank you, everybody, for your patience. Bailey's going to drive just to make sure that the computer doesn't restart again. So Bailey has typed in what I had basically searched at the beginning. Most people were interested in seeing a demonstration of our materials related to trauma-informed research and practice. And so Bailey's typed in trauma-informed, and you'll see this is just what your results page will look like. Bailey, could you click on the title of the article there? When you click on the title of an article in our library, it provides you all of the information, like the tags that we've added to these resources so that you can find them even when you're searching your own words. We've added all the synonyms we can think of and related topics that this material is mostly about. And then you'll also see at the bottom there the description, just summarizing what you'll find in there. And both from the results page and also from this record page, you can access the full text. It'll say access URL or DOI, and then it'll just lead you directly to the website that houses the material itself. That's just one example of how to navigate a record. Also, when you have this record open, Bailey, you could stay on the record. And where you see subject terms, and there's a whole list of these phrases or words, you can click on any of those and see related materials, everything that we have tagged with that same word. So victim-offender overlap will give you all the materials that have that tag. And you can see there's a diversity of types of resources, like I mentioned, on what's actually in the library. We have journal articles, but also presentation slides and recordings and reports. And if you just want to go directly to the full text, anywhere where it says View Document, then that will open in a new tab and show you the full text. So thanks for your patience. I just wanted to give a quick preview. There's also some ways that you can supercharge your search, but I really encourage you to reach out to me, and I'll also record a little quick demo about how to use those advanced search terms that'll go out when we share the recording. Thanks, Bailey.
You're welcome. Thank you, Laura. Okay, I think now we're going to launch our evaluation poll, so please hang in there and fill out the evaluation for us. This is one of the things that we have to report to OVC, so we really appreciate you hanging in there and filling out the poll for us. Susan, do you have any closing remarks while the poll is being filled out? If you have any questions, feel free to enter them in the chat. I know that we're kind of over time here, but we will follow up with you individually if you have a question for us.
Thanks, Bailey. And I don't want to interrupt anyone filling out their evaluation poll or entering questions in the chat, but I do want to thank our presenters. I think they did an excellent job of giving you a tour of the key parts of CVR's website and the resources that we offer you. But please don't hesitate to reach back out to us. If you go to the website in a couple of days and think, oh, now where was that? If you can't find it in the search bar or you can't remember how to do something, just hit contact and we are here to respond to you anytime. We really want this website and this resource center to be a tool for all of you. So never feel that you are being a bother or that you wonder if the question you have is too small. Please reach out anytime. I want to thank everyone who joined us today, and thank our presenters. Let me just do one look in the chat and see if we have any questions that have come in. So far, none. So with that, I'll say goodbye to everyone out in the audience and our presenters, and see you again on a future webinar. Goodbye, everyone. Welcome everyone to today's webinar, CVR Showcase, a tour of our offerings. My name is Susan Howley and I'm the Project Director for the Center for Victim Research. The center is built through a partnership between the researchers and practitioners at the Justice Research and Statistics Association, the National Center for Victims of Crime, and the Urban Institute. The center's mission is to serve as a one-stop resource for victim service providers and researchers to connect and share knowledge to increase access to victim research and data and the utility of research and data collection to crime victim services nationwide. Today's webinar is designed to give you a tour of those resources so you can work with us to build an evidence base for victims of crime. Center for Victim Research and this webinar are both supported by funding from the Office for Victims of Crime, which is part of the Office of Justice Programs at the U.S. Department of Justice. And now I am delighted to welcome today's presenters, 3 team members of the Center for Victim Research. First, you'll hear from Laura Puls, who's the research librarian of the CVR. She's based at the National Center for Victims of Crime. Then you'll hear from Bailey Maryfield. She's a research analyst here at the Justice Research and Statistics Association and part of the CVR team. And we'll close with Marina Duane, who's a researcher and leads the TA efforts at the Urban Institute for the Center for Victim Research.